Okay, well, welcome everybody. Thank you all for coming out today. I'm just going to give a brief rundown of what's going to happen. So there's going to be some brief remarks from Mayor McAdams, some remarks from Tim Whalen, the Director of Behavioral Health for Salt Lake County, and then me, and then I will introduce you to our clients. And after that, you guys are welcome to go through some apartments here and talk to any of us. So thank you.
Thank you. Well, thank you, Adam, and thank you everyone for coming today and for giving us a chance to highlight some of the incredible work that's been happening over the last year, really based on a foundation that was laid long before that, to expand options for treatment, to recognize the need for criminal justice reform, and that there's a better way to approach our criminal justice system. That while we must hold people accountable and there must be consequences for bad actions, that we also provide a lifeline for people who are looking to turn their lives around. And so with the support of incredible organizations like Odyssey House, we have been able to more than double the number of residential inpatient treatment beds, also increase our outpatient treatment options, and various other interventions that help people who are on the road to recovery to become stable and to become self-reliant. So I'm pleased to be here to, first of all, say my thanks to Odyssey House. Yesterday I spoke about the Sunday afternoon meeting at the county with the speaker and the lieutenant governor, where we all kind of went out on a limb and took a leap of faith, trusting each other that the treatment, the funding for treatment would become available, and that we could provide these options. What I didn't mention yesterday was that the organization that went furthest out on the limb was Odyssey House. It was based on those assurances that Odyssey House moved forward with investments of a lot of money. I don't know how much, but a lot of money, with nothing more than a commitment that there would be funding for clients for up to 6 months, and they would be paying for these facilities indefinitely. So Odyssey House really took a leap of faith, and I admired their leadership, and it's been a highlight over the last year to get to know the individuals who have also done the hard work of turning their lives around. You've gotten to know some of them this week. You'll get to know more of them. They are such inspiring individuals who are in long-term recovery now. They are in housing, they're employed, and they are graduating from these programs, and they're really an inspiration to, first of all, I think the value of a human life. You heard Amy yesterday talk about her experience, these are people who have so much to give to society and so much to give to each of us with their inspiring stories. And so thank you for helping us to recognize the value of a human life. I want to introduce Tim Whalen, who will speak next. Tim Whalen is the Director of Salt Lake County Behavioral Health Services and has been a tireless and passionate advocate for expanding options for treatment for a long time. And I sometimes give Tim a hard time because we can't have a meeting in which Tim doesn't speak about the need for expanding treatment and expanding Medicaid options. And that's happening, and it's happened, and we've made great strides over the past year, and we have options in front of us to hopefully expand that even further. So with that, I'll turn it over to Tim Whalen. Thanks, Tim.
Well, thank you very much. I'm not very good at this, so I just want to thank the mayor for those kind words and all the support that the mayor and the Salt Lake County Council have given us for behavioral health services. I also want to acknowledge other partners that are here, just a couple, and that's Doug Thomas and Brent Kelsey from the State Division of Substance Abuse and Mental Health for their leadership in helping us to get funding out to these programs. All the other state partners that were mentioned yesterday. About 2.5 years ago, we had available to us in our county about 170 residential beds. We had 6 to 9 month waiting lists for treatment. Folks that were leaving incarcerated settings had nowhere to go but to try to get into interim group services and hold on by their fingernails to try to get into treatment. That has changed a lot in the last couple of years. I want to acknowledge Representative Dunnigan for bringing together such an amazing targeted adult Medicaid expansion opportunity. Our county has really leveraged that targeted adult Medicaid. As the mayor mentioned, we went out on a limb with county, pretty much one-time money with his support, to be able to start expanding the capacity, and we got folks into service. When the state brought their resources to bear, it changed everything for us. This Medicaid changed everything for us. I've been a tireless advocate for Medicaid expansion for many years because I knew that if we expanded treatment, we could impact some of these issues. You're meeting with clients, you're going to see testimony to that they're making success of their lives after having had access to treatment. I just saw Speaker Hughes walk by. I would like to thank him as well. He played such an instrumental role with the mayor in bringing this forth to us. So today's about treatment. It's about phase 2. We believe treatment is the biggest deal. We believe it works. We believe it changes lives. And we've always believed that if we had more resources, we could do more treatment. I believe Salt Lake County has the best treatment system in the state, if not one of the country, in the country. We have a network of private providers. County government doesn't provide the services. We work with our private partners like Adam Cohen to address these issues. I think it's very effective, and you've been able to see us expand treatment in a very large way as a result of that. So I'm just going to name a couple of programs, and then I'm going to introduce Adam. So our providers include ARS, Assessment Referral Services at the University of Utah. You heard mention of assessors going into the jail to do assessments. This group went in there at a moment's notice. They said, what do you need from us? They went into the jail, they left their offices, they've done multiple assessments, and they've connected folks to treatment. I'd like to thank Donna Ditas and Kelly Lundberg from ARS. First Step House, Sean McMillan, is a great partner and provides services to this population and has also expanded resources for our folks. Project Reality, Linda Moore, amazing agency. Medication-assisted treatment. It is the most evidence-based approach to opiate addiction, and they have been a partner to help provide these services to all of our consumers. Clinical consultants, Santiago Cortez, a MAT clinic in West Jordan we just opened. They are a great provider of outpatient services for our consumers. House of Hope. Amy talked about House of Hope yesterday and how it saved her life. It's an amazing parenting program and a women's program, and they are turning around lives in our community. And the dedication from all of these programs is amazing, as you will see. Finally, Valley Behavioral Health. Becky Brown, Gary Larsenaire, they came up and they opened a brand new clinic out in the south end of the valley, 99 residential beds for our consumers, really jumped in and helped us with this cause. Finally, a partner that's been amazing to work with many, many years, Adam Cohen. I can't say enough about Odyssey House, the programs they provide. I'd like to introduce him. Thank you for your time.
Before I give some remarks, I'd like to introduce Speaker Hughes, who just walked in. So, Speaker.
So when I finish my term and there's someone takes District 51, it's going to make District 51 on time again. It's going to be a beautiful thing. We're going to have a representative that actually makes meetings when he's supposed to be here. So I apologize for being late, but I have to brag about the people that have just spoken and what's happening here. You know, I got all these, they're just political jokes. They're not, actually they're jokes for politicians, things that we think are funny that the public probably would not. Jim Dunnigan, I heard him mentioned as I was coming up. Representative Dunnigan was so focused on these Medicaid waivers that when CMS and HHS's Seema Verma, who's in charge of really presenting the waivers to HHS and looking for a state to go around federal laws or regulations, there's this crazy regulation. It might sound, you know, just one little piece, but in the rest of the country, you can't have more than 17 treatment beds in a facility. Think of the 5,000 plus people last year at this time that was around Operation Rio Grande, and think that you would have to have buildings of no more than 17 people at a time to treat those that were sick and that needed help. It doesn't make any sense at all. It shouldn't be applied to any state. But we in Utah didn't have time to change it for everyone. We needed that waiver. Jim Dunnigan Representative Dunnigan was so resolute to get this waiver that when Seema Verma from CMS would be at state legislative conferences, she would spot Representative Dunnigan in the crowd, and he would immediately chase her down and talk to her before meetings, after meetings, to the point where she could see him anywhere and knew the conversation that was coming. That's funny to politicians. We think that's hilarious that we're chasing that down to that degree, but we did. We actually scheduled the press conference at the governor's mansion or in the Gold Room, and we didn't get final word till 15 minutes before the press conference was supposed to happen, that it was actually official. But what you see here with the Odyssey House, Adam Cohen did not wait for that approval to finally come. They gambled that we were doing the right thing, that he was with a team of people that wanted to see something happen, and they began preparing those rooms or those beds as if the voucher or the waiver had already been given, and on a chance. They were, and we told you we were going to back you up, we were going to make sure that you weren't out there by yourself, but that's the kind of cooperation that you see that you just don't see typically in public policy. You're seeing something that's happened here that helps the people. I mean, you can talk data and analytics all day, but it's when you meet people who just needed a chance, and we're able to provide that chance. And you learn as a public policy maker from Mayor McAdams, from the work the county's been doing, from Odyssey House, and you're working together. And the politics, of which we sometimes can't avoid, really does get thrown out the window. And we just want to do right by people and help them. And it's, it's a funny time for me. 16 years legislative service. It's coming to an end, and I can't imagine a more fulfilling and gratifying way for me to end my public service in the legislature by being a part of and being a part of a team that doesn't worry about the politics. They just want to do right. And so, thank you to Odyssey House. Thank you to Mayor McAdams. Thank you to Salt Lake County. Thank you to all of the people that have worked on Operation Rio Grande, but the things that have happened before it and the things that will continue to happen after this project or operation with Operation Rio Grande ends next year. There's so much we've started and so much that we will continue to do. So I just wanted to brag about Adam and about the effort before he began speaking. So thank you for your time. Thanks.
Thank you, Mr. Speaker and Mayor McAdams and Tim. Yesterday at the meeting, really to distill it down, crime is down, hope is up, and people are getting better. And I can't be more proud to be a part of that. As I reflect on the last year, this was by far the most aggressive expansion of treatment services Odyssey House has ever embarked on, but as Tim alluded to, the entire Salt Lake County system expanded in a very, very meaningful way. For Odyssey House, we doubled our inpatient capacity, we doubled our outpatient capacity. This was both extraordinarily difficult, but also extremely rewarding. Our passionate staff made the impossible possible. It's been a year that has filled me with excitement and hope for the future, and it entrenches my deep belief that evidence-based treatment programs like Odyssey House and the other Salt Lake County providers are the real answer to addressing the complex needs of people with substance use disorders, that locking them up or leaving them on the street doesn't work, and it's inhumane. A few key words that I've observed over the last year. Cooperation. The sheer magnitude of Operation Rio Grande, combined with the aggressive timeline, could have been disastrous, but it wasn't. Everyone locked arms and committed to truly addressing substance use disorders and chronic homelessness. We all agreed that what was happening was unacceptable, and it was not reflective of Utah's culture. State legislative and executive leadership, the Departments of Workforce Services, Health, Human Services, District Courts, Law Enforcement combined forces with Salt Lake County Mayor's Office, Salt Lake County Division of Behavioral Health, who's been a tremendous partner, the Salt Lake County Sheriff, and nonprofit service providers to create an immediate but robust plan to address the crisis. This partnership makes Utah the example that other states should follow, and I'm really proud of that. From the state to the county to the city, and finally to agencies like Odyssey House, First Step House, House of Hope, Volunteers of America, Valley Mental Health, there's been total transparency, cooperation, and dedication to the clients we collectively serve. We were all in it together. We still are, and it's working. Hope. I've always had hope, but the results we're seeing from Operation Rio Grande have re-energized my hope for the future and have further cemented my belief that evidence-based treatment for people with addiction and mental health issues is the real answer. An unbelievable 74% of the people who entered into treatment programs through Operation Rio Grande are still engaged. That's astounding. That's better than any national average there is. That means our Operation Rio Grande clients are succeeding, and they want to get better. I was moved and watched in awe this past legislative session where one of our clients actually thanked lawmakers for providing the funding so that he could get arrested and get into treatment. Like, wow. I hear stories all the time from our clients where they say they were hopeless, that they wanted to change their lives, but they didn't know how they could. Operation Rio Grande provided that vehicle for change. The future. If you look behind you, you see just one of our transitional housing complexes. People here are in the final phase of their treatment. They've completed a residential treatment program, and this is their transitional step as they go out into the world on their own. They have jobs and a safe place to stay. They're succeeding and reintegrating back as contributing members of our community. And they now have the tools to stay sober as they face the obstacles that we all do in life. Every one of them has an inspiring story to tell. Addiction is a complicated and terrible disease, yet they are persevering in one of the toughest battles they'll ever face. They are the real heroes of Operation Rio Grande, and they energize me every day. I thank them for their courage, and I thank lawmakers from the state, county, and city for having the wisdom to envision Operation Rio Grande, but really more so the determination to see it all the way through. Standing beside me are 3 clients who came through our program through Operation Rio Grande. They stayed, they're succeeding, and they now live in transitional housing. They are reclaiming their lives from the throes of addiction, and I'm all very proud of them. So let's give them a round of applause. Just as a brief introduction for you guys, I have Carl here. He turned himself in last October during Operation Rio Grande. He successfully completed his residential stay at our Mill Creek facility. He lives at this complex and is working full-time for Premier Flooring and getting reacquainted with his young daughter, Heaven. Emily, she turned herself in last September during Operation Rio Grande. She also went to residential treatment at our Mill Creek facility and is continuing her treatment at our outpatient services and also living in transitional housing. She works full-time at Bees. And finally, Beth. Beth was jailed last August during Operation Rio Grande. She went to residential treatment at one of our downtown facilities. She completed that and is now in our outpatient services living in our transitional housing. She's working full-time for Lisa's Pizza. And she says that she couldn't have gotten this far without the support of her family. So thank you all. Thank you guys for doing the hard work. You guys are amazing. And thank you guys for coming out and visiting our facility and having the interest in the people who are getting better. So thank you all. Feel free to go through any of our apartments and interview any of us. So thank you again.